We have really two broad categories of patients who are adults and need congenital heart surgery. The first category are patients who have required surgery earlier in life when they were newborns or infants or young children even, and have new problems that were either anticipated or not anticipated that require surgery. And on the other hand, we have patients who may not have known their entire lives that they've had any sort of congenital heart abnormality. And then in the setting of symptoms that develop in the adult years, they're discovered to have an issue. Here at Boston Children's Hospital, we deal with a really wide spectrum of heart disease. In our patients who've had surgery in the past, this ranges from folks who've had tetralogy of Fallot repair or an arterial switch operation for transposition of the great arteries. We're dealing with folks who need a reoperation using a re-entry sternotomy. And among those patients, I'd say one of the most common things we do is to treat the pulmonary valve with a pulmonary valve replacement or with a conduit replacement for the conduit that they had previously had placed to provide continuity between the right ventricle and the pulmonary arteries. On the flip side, we also have a lot of patients that have aortic valve disease, and there are a lot of different reasons in the congenital population, in particular adults, where the aortic valve becomes problematic. In particular, we have folks who have had their aortic valve and aortic root replaced by tissue that's not normally the aortic valve or the aortic root. We call that a neo-aortic valve. And those valves and roots are often prone to dilation and developing insufficiency. And so those patients often require aortic valve repairs and or replacements when they can't be repaired, but we always do our best to repair those valves if we can. Our adult patients are presenting with a lot of other what we call comorbid conditions or conditions that exist in addition to the heart disease that a lot of pediatric patients don't have. That includes things like kidney disease, neurologic disease, history of strokes, diabetes, often requiring insulin, obesity, a variety of mental health issues. And so this is just a small, short list of things that we need to consider heavily in their impact on their risk for undergoing a big operation. And without specialized teams to address each and every one of those things, it's very difficult for a patient who's not just complex from the anatomy and physiology aspect, but also complex from the comorbidities aspect, to then be able to sail through an operation and the post-operative recovery without a major issue.